So, good morning, everyone. So, our group will present factors influencing healthcare service quality. So, this is a research critic paper presented by members Batalier, Bondad, Laguda, Medina, Miko, Salada, and Galien.
Research problem. Iran's healthcare system faces a number of serious challenges, particularly concerning health outcomes such as quality and efficiency. A full understanding of the concept of quality and the variables influencing healthcare services quality is needed to improve. Also, the study population, which were the respondents of the survey, was clearly identified. It was written in a way that many readers may understand. The significance of the research was identified by the authors based on the most prevalent concern regarding healthcare service quality in Iran.
For the review of literature, there is a source that each authors explain and define their perspective about healthcare quality. Few researchers have been conducted to identify factors that affect quality of healthcare services. This study have addressed this issue in Iranian healthcare organization. And this study aims to fill the research gap by empirically exploring healthcare providers, managers, payers, and policymakers' perspective on factors affecting healthcare services quality.
Okay, hypothesis. So, our group have 5 hypotheses. The first one is best healthcare service delivery empowers hospital management. The second one is the quality of healthcare service is the disparity among customer perceptions. The third one is patient satisfaction is also determined by exploring the particularity between the expected and the perceived health services. The fourth one is the implementation of good practice, preventive care for the potential to significantly enhance healthcare service. And the last one is the physician's behavior is a key factor for patient satisfaction.
The methodology, our system of methods used in our study, is a semi-structured interview in which we ask only a few predetermined questions, while the rest of the questions are not planned in advance.
Findings. The cooperation between patients and healthcare providers determines the quality of a healthcare. Patients' socio-demographic variables and their cooperation, healthcare providers' socio-demographic variables and competency, and the environment where the healthcare takes place are influencing the quality of how a healthcare can be provided. However, it can be improved by planning on how to effectively provide a high-quality healthcare service, proper training by a competent leader, and education.
As we do the summary, we included the most important in our study, which is the main purpose of our research, and this was to identify factors that influence healthcare quality in the Iranian context.
Conclusion. This article contributes to healthcare theory and practice by developing a conceptual framework that provides policymakers and managers a practical understanding of factors that affect healthcare service quality.
So for our recommendations, so what first is effective management is important enabler of quality from the perspective of providers, managers, and policymakers and payers. Second is collaboration and partnership development for practitioners. Having good support services is important. And lastly, government need to reform their law about the fee of the doctors and some medical insurance companies to make it even more affordable for the patients.
Overall critique, the researcher has not allowed personal values to influence the conduct of the research and findings derived from it. The researcher also utilized peer debriefing with 5 quality management experts.
So for our bibliography, so Ali Muhammad Mozadagrad, Factors Influencing Healthcare Service Quality. So that's all. Thank you.